assume that now somebody has been found that they are probably in the early stage. Let's talk about early stage. How do you treat an early stage cervical cancer?
Well, treatment is dependent on several factors.
Okay.
All right. Age, for one, is a factor. Fertility, whether the patient still wants to bear children or not. Okay. The size of the tumor.
Wait, guys. What do you mean? Do you mean that, Daktari, that cancer is tumor?
Every cancer is a tumor, but not all tumors are cancerous. This is because when you talk about tumors, there are two classifications. We have benign tumors and malignant tumors. So when we say a tumor is benign, we mean that tumor does not have the ability to spread to other parts of the body. So that is not cancerous.
Okay.
But when we say a tumor is malignant, we mean now that tumor is cancerous and that it can spread to other parts of the body. So we are more worried about malignant tumors than benign tumors.
Now, my question, allow me to just change something. So when you get that you have malignant what?
Malignant tumors.
Malignant tumors. So at this particular point, if this is not handled, it means that it can go eating up the uterus, climbing.
Yes. Now, when you go to visit your doctor and the results show that you actually have cancer, the doctor, your physician, will now send you to an oncologist. All right. Now your treatment plan is starting. So your physician will send you to an oncologist. Now your oncologist, the first thing they have to do is do something called cancer staging to understand the stage of your cancer. All right.
Okay.
Now, to answer your question, staging also involves assessing where your tumor is at. You see, so that's why you would hear something like stage 4 to imply that the tumor has spread. Yeah. Most stage 4 tumors, they are spread from the primary disease. We have malignancies, from the term malignant, all over the body.
So it has shifted. It's no longer cervical. It's no longer at the cervix.
The primary disease is still at the cervix, but there are other diseases. Yes. So you might have malignancies to the brain, to the lungs. No, that is advanced disease, stage 4.
You mean this small thing has just advanced to all these body parts?
Yes, but that is stage 4. Now, when your oncologist is doing staging, there are things they consider. Okay, so medical imaging will show. See? So that's why we need all of this medical imaging to assess. We then assess even the lymph nodes. You know, the lymph nodes are the ones that drain the body organs. They filter waste. So by analyzing and assessing your lymph nodes, we can tell the stage of your disease.
Wow. Doctor, I'm so educated by now. Do you think that somebody would have cervical cancer and not have the symptoms?
That's not practical, because once you have the disease, unless it's too early.
Because I'm wondering, now let me tell you why I'm asking that question. Because I'm wondering, why is somebody waiting for stage 4 cancer to develop? Why are people waiting for stage 4? Well, they could treat it, because I believe the symptoms start at stage 1, right?
Yes.
Why would somebody wait for stage 1, stage 2, stage 3, till to get to the stage 4? That's
an interesting question, and that is something that we actually need to do a lot of sensitization on, because it's actually something I've encountered in my practice. I actually was doing a test on a certain 50-year-old woman the other day, and that woman told me that she has been experiencing pain during sex over the last 10 years, and she actually thought that it's how they do it. That is affecting.
You think probably somebody is being rough or something.
Yeah, but actually, those were the early diseases, like I said, postcoital bleeding. You understand? Now, this woman is actually coming, and when I ask her, she tells me she has been experiencing these symptoms for 10 years. So, even if when she first felt it, the disease was at stage 1, by the time we were interacting with her, she was at stage 3. You see? And that is actually the time she's coming to the hospital.
Wow.
She has lived with pain, with all these symptoms for 10 years. So what actually you'd want to tell people is that they should love themselves, so that whenever there is something small happening, go consult.
Especially, I think, guys, wait, let me say this. Especially women. we are sensitive beings. I don't think anybody should stay with something, with pain, with just even when you, I think, I don't know whether it's me or something, when you get like hiccup, you want to run to the doctor. I think that's what we should talk about now.
Exactly.
Talk about people caring extremely too much about their body. That when you get a pimple, you want to know, why are you getting that pimple? It's not just a pimple. It has a root cause, everybody, guys. We have to take care of ourselves. Daktari, now, I'm still stuck at the level of treatment now, that we're looking at the early stage. We're still at the early stage.
Yes.
Now, let me ask, wait. That woman at 50, is it at stage 3, is it early stage?
No, stage 3. Okay, we actually have 4 stages when it comes to cancer, cervical cancer. So we have stage 1, stage 2, stage 3, and stage 4. In between, we have like stage 1A, 1B, 2A, 2B,
Wow.
3A, 3B, 3C. Then 4A, 4B. So that would be too technical, but that woman was at stage 3B. But now this tumor...
So that is at a worst stage?
Yes. So the first 2 stages are considered early, and then the last 2 are considered late.
Wow. So now treating somebody that is at stage 1, talk to me about it.
Stage 1 would imply that your tumor hasn't left the cervix. Tumor confined to the cervix. That's the definition of stage 1 tumor for CS cervix. Okay. So if your tumor is still confined to the cervix, it's actually very easy to treat because we just need to cut it out. All right. So most of the recommended treatment for stage 1 tumor is surgery.
Stage 1 is surgery.
Yes, actually for all cancers, not even just cervical cancers. The recommended treatment plan for early disease is surgery.
So stage 1, they'll still be operated.
Yes.
But the kind of operation is not like that of stage 4.
Yes.
Okay.
Because now with stage 4, the tumor is bulky, the tumor is involving a lot of blood vessels, a lot of nerves. So definitely treating stage 1 is easier than treating stage 4.
Okay. So, and do you think that you can have those symptoms and still not have cancer? Cervical cancer?
That's exactly the point. You see, in medicine, symptoms mimic many diseases. It's called a differential diagnosis. So different symptoms might mean different diseases. So even when you go to the doctor and you tell them your symptoms, the doctor won't jump out and just say it's cervical cancer. He will imagine in your head it could be cervical cancer. So
he will.
Yeah.
Okay.
So he's sending you to the lab, medical imaging, to ascertain, to confirm the diagnosis. That is the purpose. That's why it's called a diagnosis, to confirm. So in the lab, they'll take a biopsy. A biopsy is a sample of your tissues. That sample will be taken to the lab. It will be analyzed. If it is consistent with the neighboring cells, then it will be taken to medical imaging, preferably CT scan. CT scan will show us if you have the disease or not. We'll be able to see if there are involved lymph nodes or not. And then now your doctor will now come using these results to tell you if you have cancer or not.
Now tell me, is it easy for me, the patient, to read the results?
I wouldn't say it's easy, because then you would have to be very scientific.
What is a pathology report?
Yes, a pathology report is actually the report of all those tests. Okay.
That's why I was asking,
Yes.
is it easy, all those tests that have been made, is it easy for me to read my own report?
No, it's not. So when the report is actually made from the lab, from the medical imaging, because every point you are sent in the hospital, you are given a report. So you might actually end up with about 5 reports. So it's the work of your oncologist or your physician to now explain to you what your reports are saying. No one is expecting you to go home with your reports and read and understand what is going on. No, they actually explain what is going on to you. But you are advised to keep your reports. You will keep them, but it doesn't mean that now you can read and interpret them.
Okay. Fair. What are the chances? Before I go to the viewers' questions, I saw that you posted some questions over here. I'm still going to air that, but allow me to ask one more last question. So, Dr. Karanja, what are the chances, assuming that everybody, that you have gone through the treatment, so what are the chances for that cancer to come back?
All right. When it comes to cancer management, we actually do not say that you have been cured. we usually say that you have gone into remission. All right?
Okay.
And I'll explain that more on that when we are talking about follow-up. So, when a cancer patient has completed the treatment, all right, and we have done the tests and we have confirmed that there is no more cancer cells, we say that that patient has gone into remission.
Okay.
So remission means there is a possibility of that disease coming back. So when we do follow-up, we check to see if the disease is returned. So we'll say like you are 1 year into remission, 2 years into remission, 5 years into remission. You understand?
It can even be 10 years.
Yeah, even 10 years, even 20. So it might never come back, but we won't say you've been cured. We'll say you're in remission.
I saw somebody posting, how do you treat cervical cancer?
All right. Treatment of cervical cancer is dependent on various factors. 1, age. 2, size of the tumor. 3, location of the tumor. 4, the performance status of the patient. Performance status meaning how is the patient? Is the patient weakly? Is the patient with energy? No. So cancer patients come with other diseases. The patient might be diabetic, might have pressure. So that is what I mean by performance status. So all of these inform the treatment plan. But one thing to note is that cancer treatment is multidisciplinary. When the people who organize your treatment plan involve surgeons, oncologists, radiation therapists, oncology nurses. So it's a multidisciplinary team that discusses how to manage your treatment. All right?
Wow.
Yes. So once we have evaluated the stage of your disease, if it is stage 1, stage 2, stage 3, stage 4, we'll now develop a treatment plan. Okay? So we said that for stage 1 and early disease, surgery is the recommended treatment modality. But actually it's noteworthy that surgery and radiation therapy actually have similar results in terms of curative rates. Okay? So either or can be used, but surgery is preferred as a treatment modality of choice for early disease across all types of cancer. Okay. Now, when we come to advanced disease, we prefer to use a combination of both chemotherapy and radiotherapy. So we call it concomitant chemoradiotherapy. Okay, so we actually give you cisplatinum. Cisplatinum is the drug that we give you during chemotherapy. So we actually give you once a week, so that it actually makes your cells more radiosensitive. So you are given cisplatinum like on Monday, and then you come for now radiation therapy sessions from Monday to Friday. So
every day.
Yeah, every day. So when you're given that cisplatinum, it makes your cells to be radiosensitive, such that when we treat you with the radiotherapy, you actually achieve better results. All right?
Okay.
They are called radiosensitizers.
Radiosensitizers. So after you said somebody can be 10 years, 20 years and still not completely healed.
No, you are healed. It's just that we say you are in remission.
You're in remission. So chances are still there.
Yeah, there are always chances of the cancer coming back, because now you know the cancer cells are microscopic. Yeah, so there's no way I'll evaluate your entire body using a microscope to confirm that you really do not have any cancerous cell. So using the modalities that we have, medical imaging like a CT scan or an MRI, we'll take images, and if we can't find any signs of disease, we'll say you are in remission.
Okay. So someone asked today, how do you now follow up on a client that has just gone through all that?
Right.
What follow-up techniques or whatever you guys call them? How do you follow up on a patient like that?
All right. So once you've completed the treatment, we have a cancer registry in Kenya. So of course you will be registered that you had this type of cancer, you've undergone treatment, you've completed treatment. Your oncologist will evaluate you, and we also give feedback to your physician. But then we do follow up once a year. Okay? So we'll do follow up during that year and confirm that there is no recurrent disease. Then the following year, then 5 years after that. Understand? But the incidence, the number of times that you need to come for follow up reduces gradually. Like the first year, we might ask you to come after every 3 months. But then after like the third year, we might ask you to come yearly. You understand? So that is how we do follow-up. And then follow-up, when you come, if it's cervix, we want to do an exam. We want to ask you how you're feeling, any symptoms. You might even do imaging. You understand?
And Dr. before we close, because we're about to close, who will be leading on the follow-up?
The follow-up is conducted by oncologists.
Okay.
So you will visit the clinic. It's called a cancer clinic. Okay. All hospitals that you attend have a cancer clinic, right? So you will be received by nurses, oncology nurses. They will have several oncologists ready because the cancer incidence is high. So you will have several doctors. So actually, to answer your question simply, is that review is done by oncologists.
Now, there is one question that has been repeated on our show today, and that is, isn't treating cancer expensive? Because Dr. I've had people complain, once you hear the name cancer, you know your account is about to go dry. Talk to us about that.
Well, healthcare is expensive, I'm afraid. Every type of healthcare, not just cancer treatment. So what I would advise is for our viewers to actually get insurance. Okay. So if in Kenya, get your NHIF. If in another country, do the same. Because an example with Kenyan system is that the insurance pays for about 80% of your radiation therapy expenses. Okay.
Wow.
So if you are being treated about 25 sessions, you will find that the NHIF will pay for about 20 of those sessions. The first 20 actually.
Wow, that is amazing. I didn't know that, and I think, Doc, before we even conclude on this show, we have to talk about that part, that you have 25 sessions and your insurance will cater for 20.
Yes.
20.
Yes.
Now, give us an estimate of a session, one session.
So in the Kenyan setting, one radiotherapy session costs about 3,600 shillings.
Around $36.
Yes. So you'd see that when you accumulate them, 10 sessions would be 36,000. So 20 would be about almost 80.
Ooh,
all right?
Yeah.
And we need about 25. So you can see it's a lot of money.
It's a lot of money, guys.
So when the insurance is offering to pay for you 20, the first 20 sessions, so that you prepare to pay the final 5, you see it's an opportunity people shouldn't be missing.
Yeah.
Yeah.
Now, last question. I know I said I'm going to ask the last question, but we have so many questions, but let me pick one. Are there foods that people that have gone through that are told not to eat and what to eat?
All right. When actually you are being treated during your management, like I said, it's a multidisciplinary team, and I forgot to mention that a nutritionist is part of the team.
Yeah.
So your nutritionist will assess you and will be able to advise on the particular diet you're supposed to observe. But of course, I can quickly mention that there are foods that will help in the management of your cancer, and those are called antioxidants. So those are foods that are rich in vitamin C, vitamin E. Those are the foods like carrots. Basically, it's just fruits and vegetables. But I think a nutritionist is better suited to explain how you should design your diet. But our viewers shouldn't worry, because a nutritionist is actually part of the team that you meet in the hospital.
Interesting. Doc, before we can even close the show, give us your parting shots.
Well, I would say cancer is really a tricky thing, but there's more we can do in terms of improving the lifestyle and the management of this disease, especially in the sub-Saharan African. So I'd advise that people really love yourself. Whenever you're experiencing symptoms, be quick to go to the hospital. Let us treat your cancer when it's in early disease, because this improves your chances of actually getting healed. It's unfortunate that most of the people we treat have advanced disease because of coming to the hospital late.
Wow.
And it actually makes now the perception that people don't actually get cured from cancer, and the problem is actually we are dealing with very advanced disease. So
wow. Guys, I'm going to pin Daktari's number here. So Doc, give us your numbers.
Well, if you want to reach me, I would suggest you use the email. Reach me at kalimsam@gmail.com. And those who want to call, I'm available at 0700-714-739. Thank you for having me.
Guys, please book an appointment with Daktari. He's there to advise, to also get to, to talk to. I believe he's one of the most easy Daktaris I've met, guys. So we will try and find Daktari in another session somewhere. We will figure out, guys. But I hope you enjoyed the show, and please catch us on our next episode where we will be giving you the juicy, the hot, the amazing, and especially our aim here is to educate you guys. So see you on our next episode. Bye-bye and bye-bye.